So thank you 3IE for giving me this opportunity to present my work. I look forward to your comments. So the topic of today's presentation is, can MGNREGS buffer negative shocks in early childhood? Evidence from Andhra Pradesh, India. So there is a host of economic literature which indicates that early life conditions matter critically for the long run development outcomes. For example, starting from in utero till the first 3 years of life, these years are most critical years for investing in the child. There has been a host of increasing evidence from the economics literature which tells us this, and where shock exposure during those critical periods, between the first 3 years of life, even starting in utero, has severe long-term consequences on long-term human development outcomes. For example, on schooling, on cognitive achievement, labor market outcomes, even marriage market outcomes. So it has a host, there is this persistence of the negative shock that happens early on in life, and which even gets translated beyond generations. So there is this intergenerational transmission of the effect of shocks. So earlier deficiencies in human capital is very likely to be transferred across generation, and health in early life is more significant determinant of adult outcomes for developing countries, as has been pointed out in a recent study by Daniel Curie, where we might expect that these shocks are more frequent, the capacity to remediate or to ensure is limited, so the individuals have very little options to smooth their consumptions. And these, they face multiple shocks. So multiple shocks may interact. So the important question to ask here is catch-up at all possible? So there is this understanding that the first 3 years of life is the most critical period. However, if you suffer in the first 3 years of life, is there any possibility to remediate or make up or mitigate these negative impacts if you have a social assistance program or a better nutritional environment later on in life? How much can you remediate? And that aspect has been very much understudied till now. So there exists biological potential for catch-up. So we have some medical literature which tells us that there is still some potential where individuals can make up for early deficits, even if he has suffered in the first 3 years of life. If he gets a better nutritional environment, there is accelerated growth, which is basically mitigating the negative impacts. And there is just one study taking the case of rural Ethiopia by Yamano, which points that there is this food aid program in rural Ethiopia which was very effective in reducing child malnutrition. However, no such evidence exists for the case of India, and we have a so huge public works program. So the underlying hypothesis of my study is that these are primarily agricultural households, rural poor agricultural households who are mostly dependent on rain-fed agriculture. So when these households who are rural, in the rural setting, they are totally rain-dependent agriculture. So when they face drought shocks, it has severe negative impact on their household income, which has negative consequences for the investment in the children. For example, these individuals often resort to taking children out of school or deferring healthcare payments, and basically there is this negative investment for children when they face the shocks, these transient shocks. So which has negative consequences for the nutritional outcomes. So the hypothesis is, if you have the access to a social assistance program like the MGNREGS, which is guaranteeing you cash flow in the otherwise situation of downturn. In an otherwise situation of no employment, this type of work is guaranteeing you some cash flow in order so that it is expected that this kind of program is enabling the households to maintain their food basket, to maintain their consumption, smoothen their consumption. So one can expect that when you have the access to the program, it would have positive consequences for the nutritional outcome for the children. Although the program per se is not directly tied to improving child nutrition. However, when you have the access to such programs, there can be a host of channels through which you can expect positive nutritional outcomes for the children. For example, when you have women's independent income. So one of the aspects of the program was increasing women participation in employment. So they had 1/3 reservation for women, and to give incentive for new mothers to work, they had also mandated childcare centers at the work sites. So there are separate studies which points that when women have independent income, they make positive investments for children, for example, increasing schooling investments and dietary decisions. So these all improve nutritional outcomes for the children. And there are other studies which finds that it has also reduced migration, which again one can expect would have positive consequence for the nutritional outcome. So what my study tests here is basically using the access, the variation in access to the program. How does the access help the household in mitigating the negative shocks? Does it really help? So just to give you a brief background of the program, although all of you know the details by now. So this is the largest employment guarantee scheme in the world. By 2010, it reached 52 million households across the country. The important aspects of the program is it provides legal guarantee of 100 days of employment. So this is the act, this is the right to work. So to adult members of rural household willing to do unskilled manual work at a minimum wage of around rupees 120 per day, which is equal for men and women. And this is another important aspect of the program in the sense that the otherwise casual wage for women, there's this huge wage gap between men and women in the agricultural casual labor market. And it has also incentives like childcare centers for young children of women workers and 1/3 reservation for women. Now, another aspect of the program that has been newly developed is the provision of private land development for SC, ST and BPL households, where they can use this program to privately to develop their private lands. And regarding this study, I had visited 6 villages in Andhra Pradesh, and I found that this aspect of the program is largely working in those 6 villages. So people were utilizing the funds to develop their own fields. So they were planting horticulture, there were horticultural fields, and people were utilizing this aspect of the program to their own benefit. So now one of the interesting aspects is it has been rolled out in phases. So the program was rolled out based on a backwardness index that was developed by the Planning Commission, which used 3 things. First is the agricultural productivity per worker, agricultural wage rate, and the composition of SC/ST households. So based on these 3 things, they created a backwardness index, and the program was rolled out based on the backwardness index, in the sense that it was rolled out to those districts which needed it most. So in the first phase, in year 2006, 200 districts of the country was covered for the program, under the program. And then it was expanded to the phase 2 districts by year 2007, and by year 2008 it was universalized all across the rural districts of the country. So this is to just show you that the targeting aspect of the program has been largely working. In the sense you can see that there is highest participation from these 2 quintiles, poorest and the near poorest quintile. So one of the aspects of the program was people would self-select themselves into working into the scheme. So that you have a minimum wage, and those who required the work, they would only self-select themselves into working into the scheme, and that has been largely working, as has been also indicated by other studies. So the data that I'm using primarily is the household data comes from the Young Life survey. This is a panel data from Andhra Pradesh. It follows 2,000 children who were aged 1 year in the first round of the survey. So the first round of the survey was in 2002. Second round came in 2006 and the third round was 2009-10. So these children were followed for these 8 years and now they have just released the fourth round of the survey. So it involves a multi-stage random sampling from 20 sub-districts or mandals, and it has detailed anthropometric measures of the child. For example, it has measured the child height, child weight, and other morbidity indicators for the child. And it has a rich set of demographic information for the household as well as for the community at the village level. So it has a very rich set of data giving you the child anthropometric outcomes. By anthropometric, I mean height for age and weight for age. The other data sources that I am using is, first is the administrative records of the NREGS, coverage by mandal. So, being the state of Andhra Pradesh, it has kept records all digitized from the time it started. So, I could utilize the administrative records, which is basically the average number of days provided per household in that mandal. And I also use program intensity, which is the fraction of years the program was present in one's sub-district. So you might expect that the quality of program implementation may have changed over time. So controlling for program intensity is able to control for some of those concerns. I also have administrative records of annual rainfall by mandal. So I have constructed drought measures. Primarily, I have two measures, cumulative and recent drought. So drought, I consider drought, recent drought, is having exposed to lower than long-term average rainfall for a given location. Here the location is a mandal. So, see if some mandal received lower than average, long-term average rainfall, I consider it to be a drought exposure. And for cumulative measure, I use the fraction of years the child was exposed to drought, using the same definition. I also have constructed other forms, other severity of droughts, but I would now stick to this definition for this paper. And I have collected administrative records of health facilities by mandal and by villages. So the background characteristics of Andhra Pradesh, here over 80% of the population depends on agriculture. There is high prevalence of malnutrition, and one of the indicators of malnutrition is stunting, which is having height for age less than 2 standard deviations below. So 42%, over 42% of my sample, not my sample, but India in general, Andhra Pradesh is 42% are stunted and 32% are underweight. Underweight is having weight for age less than again -2 standard deviations. However, Andhra Pradesh is one of the first states to have digitized all the records of the program of the implementation, and it is also one of the first states to have institutionalized social audits for program monitoring. So, given this setting, it gives me the ideal setting to explore my question, that whether the access to the program has at all benefited the households in recovering the deficits. So this is the map of Andhra Pradesh. So the light colored districts, these districts are the phase 1 districts. So these are the districts which you can think as the relatively the most poorest districts, so which got the program in the first phase. The red stars indicate the sample districts from Young Life survey. The light blue colored districts, although the color is not so visible here, these are the phase 2 districts, and the dark blue are the phase 3 districts. So phase 3 districts would include West Godavari from my sample, which is a very rich district. And as if you compare with Anandpur or Karimnagar, So these are typically the backward districts which got the program in the first phase. So what I am utilizing is this variation in the rollout of the program across the districts in order to identify my question. So my empirical strategy is to compare height for age trajectory of these children across mandals that do and do not get access to the NREGS between 2002 and 2010. So what I use is variation over time and also intensity of the program. So I interact the program with drought shocks. So drought being random, when you interact it with the drought shocks, and the idea is if you have drought like a random shock, then the program is all the more beneficial when you face these kinds of shock. So what I am essentially testing is when you have a drought, then does this program really help you buffer some of the negative impacts of these shocks? So now there are several estimation issues involved here. First is there is selection issue at two levels. First, it is a targeted rollout program. So as I was just mentioning, it was rolled out to those districts which needed it most. So you might expect that these districts are different than those which got the program later. And the other one is the self-selection mechanism of participation. So the individuals self-select themselves into participating into the scheme, and so you might expect that those who are participating are somewhat different in some unobservable characteristics than those who choose not to participate, and how to account for that. So what I have in my data is I have a panel data. So this is the same households are being followed over time. So any time invariant characteristics, which unobservable characteristics, are getting absorbed in this form of estimation. For example, factors like inherent healthiness. You might wonder that if the child is inherently unhealthy, or it has a genetic, the child is prone to be short genetically. So all those factors are being controlled as I am controlling for the child fixed effects. Then you have parental preference, norms, household practices, all these unobservable variables that has independent effect on child outcomes are being controlled for in this estimation, which I am going to show you just now. However, I have to worry about the time varying features. So I try to control for time varying variables as much as possible. For example, health infrastructure in a village. Then whether the child was subject to any food supplement. Then the age of the child. So any variable that is changing over time and has a independent impact on height for age, I try to control as much as possible for that. And since I have, so the treatment units, so I have 20 mandals. So that is my treatment unit, and to control for low number of treatment units, I use robust bootstrap standard errors to deal with the small number of clusters. So whatever I am reporting, it is standard robust clustered errors clustered at the level of mandal. So this is my estimation equation. So this HIJT is height for age of child I in mandal J in year T. So I am regressing this on drought shock. So TR is a measure of drought, and you would expect that beta 1 is negative and significant. Then you have the coverage, which is the average number of days the program was available for a household. And then you have the interaction of drought and coverage. So if you, the parameter of interest is beta 3 here, which is if you find it significant and positive and significant, it means it mitigates some of the negative impacts of the drought. So I'm going to test whether it is happening or not. And I control for all time varying factors like age, health facility, food supplement, and this is the child fixed effects, right? And I have 3 rounds. So I'm using 3 rounds of panel data, which is merged with the administrative data for the controlling these time varying factors. So my parameter of interest is primarily beta 3. So just to show you the summary statistics 5 standard deviations. And this is only for the phase 1 locations. So these are all poorer districts. And if you have a drought, it has significant negative impact on the height forage. However, there is, and between first round and second round, there is this decline in the height forage score. But that is, other literature points out that there is generally decline of height forage between the first 3 years of life in a developing country. So even after that, you see a stark difference between those who suffered from drought and those who didn't. So again, the summary statistics. So when you don't have coverage, then having a drought is significant. So it reduces your height forage significantly. However, when you have the coverage, having a drought is no longer significant. Again, to show you the summary statistics by parental characteristics. So these are the 3 rounds of the survey. So you can see that the households with parents who have below than primary education, you see the stark difference in height forage for their children. And not only that, it is persisting over time, this difference. This is the average height forage by caste of the household. So this is the general caste and this is the backward caste. And there is stark difference in the height forage outcomes by caste, and not only persisting, it is even increasing with time. So just to show you some of the basic results, this is the height forage results by drought and the coverage. So what we find, this is for the rural sample, and all specification includes child fixed effects. So drought reduces height forage by 0.37 standard deviations. This is huge. However, when you have the access to the program, if you look at the interaction term, you see a positive and significant effect. In the sense, it is mitigating some of those negative impacts of drought. However, we don't find any action in our urban sample, as we don't expect them also. So this is just plotting the interaction term. So what we see is, here is the number of days under the program. So when you increase the number of days, this mitigation is also increasing as expected. Now, how robust are these results? So I have tried to construct several competing measures for the program. First is the one that I was using till now, the average number of days available to a household for a particular mandal. And then I have a second measure which is corrected NREGS, which is basically this measure but corrected for very low participation, self-reported participation. So in my data I have information on whether the household participated or not. So if I find that for a sub-district, if the participation is even lower than 5%, I declare it to be 0. So this is much more refined measure. Now this is the program intensity, which is the fraction of years the program was present. If you worry about if the characteristic of the program was different over time, then this should control for that. And this is NREGS participation, playing a question whether you have participated or not. So these are 4 measures of the program, and for each of these specifications, so every specification controls for the child fixed effects and the regular control variables. So I'm just showing you the coefficient for drought, this significant negative for all across the specification. And if you look at the interaction terms, we find that it is positive and significant for all my specification, right? However, the magnitude is different. So here the magnitude is the highest, because this you may worry that it has some measurement error problem. This is like self-reported participation. So those who would require, they would only participate. So it is not perhaps the best measure. So these are the results by gender. So I don't find significant difference by gender. However, by caste, I find that the SC/ST households, which are the households this program had in mind, I mean, it was trying to target the most vulnerable households, and we do find that if you look at the interaction effect, it is positive and significant for those households by caregivers' education. So as you can expect that the households with parental education below the primary level, drought takes a severe negative impact, which is statistically significant. However, when it comes to the interaction term, we find that it is serving as a buffer for both of these categories of households. Now comes another aspect of my analysis. So till now I have been showing you the impacts of recent drought. So the drought was measured if it was having lower than long-term average rainfall in the last year. So now I'm going to show you the impact of cumulated drought, which is the fraction of the years the child was exposed to drought from its birth year till the point in survey. So it is capturing this cumulative impact of shocks. And what I find is, it has severe negative impact on height for age. However, when you look at the interaction term, we don't find any statistical significance. So what it does tell us is that when we are talking about cumulative shocks, we see that this program has very limited impact in helping the households in correcting for very past shocks that has accumulated over time. So to summarize my findings, so we find that exposure to drought has significant negative impact on height for age. It reduces by height for age by 0.36 standard deviation, which is actually very huge. It's more than even the rural-urban gap. And it increases average stunting by 8%. So although I didn't show you my results on stunting, I find that it increases average stunting by 8%, and when you have the program, it is able to mitigate around 0.3% of that negative impact. So catch up in height for age is around 0.24 standard deviation, which is bridging about half the rural-urban gap. However, we find that there is limited scope of remediation of correcting the cumulative past deficiencies that has accumulated over time. The results are robust to alternative definitions of program and drought severity. So I even changed the severity aspect of the drought. So I declared drought to be like a severe drought if it is even less than 30% of the long-term average, and the result still stands. And it highlights the extreme vulnerability of the child outcomes in these rural settings, which has very limited insurance mechanisms, which underscores the importance of timely insurance mechanism. Because once you have this negative shock early on in life, it not only persists in the long run, but it also translates across generation. So what are the policy insights one can draw? Timing definitely matters. So the timing of the program, so one of the interesting aspects is mitigation could have been perhaps higher if it had come much early on. So these children in my sample got the program when they were around 4 to 5 years old, which is considered to be, you are out of the critical period. The first 3 years of life are the most critical periods. So if these households had the program in the first 3 years of life of their children, perhaps the mitigation would have been higher. And Andhra Pradesh has been one of the better performers of this program, in the sense that it has digitized all the records of program implementation. It has created a transparency aspect by institutionalizing social audits. So perhaps it would be wrong to generalize these results for other states. And there are other studies by one of the World Bank report indicates that the program has failed to deliver in those states which needs it most. For example, the very poorest states weren't able to generate so many days for the program, so it wasn't able to match up with the demand. So perhaps it would be wrong to generalize it outside of Andhra Pradesh. And one of the important aspects is, while we are going forward now as to how to take on with the program, so there are debates at the government and the policy making level that what are the synergies to tap, and which requires a rigorous cost effectiveness analysis of the program. And if it is only based or wage, it would be